Hi everyone, I'm Lily. I'm a master's student here at MIT studying machine learning, and I also did my undergrad at MIT, during which I was a member of the varsity cross-country and track and field teams here. Some people are surprised when they hear that MIT has sports, but yes, and this was an incredible experience, and my teammates are still some of my best friends. Some of them are actually here today. Yeah, and what was unfortunate about this experience was that throughout my 4 years on the team, I ended up developing 2 pelvic stress fractures, which meant that most of my time on the team, I wasn't able to compete or run at all. And I got so good at using crutches that someone posted about me on MIT Confessions, passing them in the hallway while I was crutching. But what made this experience even more unfortunate was that I was far from alone. Out of the 31 women that were on the team with me at some point during my 4 years, 8 of them developed one or both of the same exact injuries. And that is more than 25% of the women's team. And at the same time, out of the more than 50 men that were on the men's team, none of them developed any of the same injuries. So this just didn't really feel like a coincidence to me, and it left me and all of my teammates with endless questions. Like, are women really more likely to develop pelvic stress injuries than men? Is there something that we should be changing about our training or our environment that can prevent these injuries from happening? And should we maybe be syncing our training plans with our menstrual cycles? These are not crazy questions to ask, and in fact, every single one of my teammates had the same questions, but none of us knew the answers to these questions that felt so fundamental to what we were putting ourselves through every single day. And I soon realized that this was representative of a much larger issue, which is that we don't know a lot about women's health. These unanswered questions go far beyond just athletics. For example, women have no idea when they're going to go through menopause or how menopause will present in their bodies. So this largely stems from the fact that a lot of the health data that makes up the modern day healthcare systems is not based on females at all. And in fact, only about 1% of the global healthcare research and innovation is invested in female-specific conditions beyond cancer. So this ends up having really unfair outcomes for women in healthcare. For example, across 770 diseases, including diabetes and cancer, women are diagnosed on average 4 years later than men. And in addition, women are 2 times as likely to suffer from adverse side effects due to medication than men, probably because they're often purposefully excluded from research trials out of fear that their hormones might skew the results. So how do we actually get from where we're at right now to a place with equitable healthcare outcomes where women don't have to look so far for the answers to their endless questions? Well, I was really excited when earlier this semester, I found MIT's new Female Medicine through Machine Learning Center, which aims to do just that using AI. It was launched just earlier this semester, and it brings together the top researchers in women's health who are right here at MIT. AI shows a lot of potential in the women's health space because of its ability to identify patterns in really large and complex data sets. Let's take, for example, an issue that doctors and researchers have been trying to solve for years, which is diagnosing endometriosis. Endometriosis is a condition that affects 1 in 10 women, and it can often only be diagnosed through surgery. So let's say we have a patient who has been in and out of the gynecologist for more than 10 years, trying to figure out why she has such painful periods that literally prevent her from going to work every month. What if instead of having to diagnose her through surgery, we had an AI model that was trained to take her genetic information, her saliva or urine samples, along with a report of her symptoms, and immediately screen her for endometriosis without even having her visit an in-person clinic? There are efforts to do just that and more using AI, including by Professor Marzia Ghassemi, who is here at MIT and working with FEML. AI has already shown a lot of promise in the healthcare space, in other diagnostics as well. For example, in identifying various lung conditions based on x-rays or patterns indicative of cancer from MRI or CT scans. So yes, AI can finally let us answer questions about women's health that we haven't been able to answer in the past. So why are we not going and deploying it everywhere we can? Well, unfortunately, AI is not a perfect solution. AI models are only as good as the data that we train them on, and they can very easily reproduce or even worsen the very biases that we're trying to correct here. So if AI models are trained on data sets that are not large or representative, whether by sex, race, or geography, they can worsen the disparities that are already there in medicine that we're trying to solve. So let's, for example, take the study done by researchers that uncovered the fact that state-of-the-art chest X-ray diagnostic models were underdiagnosing female, Black, Hispanic, and low-income patients. This means that those models were more often falsely labeling those patients as healthy, which meant that they missed opportunities for treatment. So this is just an example of what happens when we train AI on data sets that are not inclusive. So this may seem a little bit scary, but this is just another part of the problem that we are trying to solve through FEML. And yes, it's true that data sets that are both large and representative have been hard to come by in the past, but we also live in a world today where people literally walk around with smartwatches or even rings that are constantly collecting data that can be used to build AI systems. And this area is so under-researched that there is massive opportunity for innovation here. If we do things right by building inclusive data sets, validating rigorously, and following guidelines, we can finally leverage technology to answer the questions that women have been asking for decades. And this is the exact kind of work that I feel so motivated to do, which is why earlier this semester I teamed up with my friends along with FEML to build an AI-powered solution that aggregates the relevant research literature on a topic that many women have endless questions about, which is birth control. As of right now, women often go through a very painful trial and error experience with choosing the type of birth control that works for them that often involves side effects such as depression, mood swings, weight gain, just to list a few. And so what do? They turn to forums like Reddit to ask their questions or search endlessly for stories that sound like theirs. If you go to the Reddit birth control channel, it is pretty crazy and gets updated every single day. So what me and my friends started building earlier this semester is a platform where women can indicate their current experience with birth control along with their age, and they can ask any question just like they would on ChatGPT about birth control, and they'll be presented with a response that's actually backed by scientific research and can provide them with the exact personalized information that can help them make an informed decision for their bodies. And it also allows women to ask these questions in a private manner. So this is just one example of the kind of projects that exist in this space and what we can do when we start building for care and equity rather than just for scale and speed. So if there's one thing that I want you to take away from this, it's that we cannot keep asking women to wait. We live in a world today where we have access to the technology and tools that we need to close this knowledge gap. We just need to start building systems keeping women and underrepresented groups in mind. AI systems are a reflection of what and who we choose to value, so let's make sure that we're all part of that from the start. Thank you.